Okay. Um, so thanks everybody for joining us. This is the 8th installment of the Unity Band's speaker session. For those that might be joining us for the first time, generally what we try to do is we carve out like half hour every month to present the community a topic that's related to our mission. So supporting healthcare heroes. Maybe we bring in like a healthcare professional, maybe we bring in a senior leader from another nonprofit, and we try to just address the topics that the community is interested in. We do a survey, so folks will say, hey, we want to hear about legislation in COVID, or we want to hear about how we're supporting the healthcare heroes. So we do this once a month, last Monday of every month, for about 30 minutes. So a little bit of discussion, a little bit of Q&A. So with that, I'll wrap up tonight with a couple of upcoming dates, but I wanted to introduce Kathy. So when we started Unity Bands, I was having breakfast with a local restaurant owner here in Maryland, and his name's Eddie Conway, and he said, you know, you really ought to talk to the folks at the Baltimore Washington Medical Center Foundation. And then literally 2 minutes later, he's on the phone with Kathy and her team. And, you know, since then, you know, we really had a good partnership, and, you know, we're proud supporters of the men and women at Baltimore Washington Medical Center. So, you know, it's been like, you know, a couple of years now, and, you know, we found several different creative ways to, you know, come together and support the healthcare heroes there. So I thought the timing was right to invite Kathy, and you know, she's the executive director and VP for that foundation. So we're thrilled to have her. And Kathy, I'll turn things over to you.
Thank you. And everybody can hear me, right?
Yes.
Okay, perfect. Thanks. Thanks, John. John asked me to speak a little bit tonight about our employee assistance fund. But what I wanted to do actually is talk about kind of our broader initiatives here in the foundation for basically supporting all the initiatives we do that support our frontline workers. I thought it was a bigger story than just the employee assistance fund, which I am going to include, but I wanted to talk a little bit more about just all the initiatives that we have, and the importance of what we call tonight's topic is investing in the heart of healthcare. So let me just share my screen. Hold on 1 second. Choose here. Here we go. Okay, so we're calling it investing in the heart of healthcare, helping frontline workers build a healthier future. And before I get into some of our initiatives, I'd like to just tell you a little bit about University of Maryland, Baltimore Washington Medical Center. It sounds like not everybody on this Zoom is from Maryland. Is that correct? Okay. So we are a community hospital, part of the University of Maryland Medical System, located in Anne Arundel County, Maryland. Anne Arundel County's claim to fame is Annapolis. So I'm not sure if everybody's familiar with Annapolis. It's about 35 to 40 minutes away from Washington, D.C. And we're about 30 minutes north of Annapolis. Still in Anne Arundel County, we're one of 2 hospitals that support Anne Arundel County. We have been supporting Anne Arundel County and the surrounding region for close to 60 years. Actually, 2025 will be our 60th anniversary. We have 314 licensed beds and employ over 4,000 team members and medical staff members. We are part of the University of Maryland Medical System, as I mentioned, and we're actually the 2nd largest medical center in that system. And for those of you who might know of the University of Maryland Shock Trauma, that is part of our system. And shock trauma is an internationally recognized trauma center that does trainings around the world to all of our military. And it's just an amazing, amazing resource that we have here in the state of Maryland. Our hospital, while it is a community hospital, we have 10 centers of excellence. We have one of the busiest emergency rooms in the state. We're the only hospital in Anne Arundel County and one of only a few in actually the state of Maryland that has an inpatient psychiatric unit. We have 24 beds in that unit. And we have an internationally recognized intensive care unit team. We have a lot of programs and a very strong focus on keeping our community healthy outside the walls of our hospital. And that's through our primary care specialties, our population health initiatives, and community outreach efforts. And so, you know, people have a kind of a connotation of what a community hospital is. And I think a lot of opinions on the types of care that you can get. And so we are a community hospital here, but we have leading edge technology. We have nationally recognized and internationally recognized quality and innovation, personalized and compassionate care, and outstanding team members, a really strong culture of community here. But we also, because we're part of the University of Maryland Medical System, have access to and all the additional resources of a renowned academic health system. And that's reflected in the quality of the care that we're able to provide. So I am the BWMC Foundation. I'm in that. And we are the philanthropic arm of BWMC. And so we are our own separate legal entity. Most foundations for most hospitals, and in the state of Maryland, all foundations are separate legal entities, but we exist solely to support BWMC. Our mission is to build and grow relationships and financial resources so that BWMC can provide the highest quality healthcare to the communities that we serve. And in the state of Maryland in particular, I know a lot of people think hospitals, you know, are so huge, they make so much money, healthcare is so expensive. In the state of Maryland in particular, because we have a little bit of a unique model with CMS and Medicare and Medicaid, our hospital margins are, in the state of Maryland, you're lucky to have a 3% margin. And so for us, and actually coming out of COVID, to get to 3% would be incredible. It would be miraculous right now. So because our margins are so small and so tight, the BWMC Foundation and I think all foundations actually in our system and across the state really help fill the gap between the capital that we can use and the money that we have for operations and reimbursements, and the need for real strategic capital, technology, and programs and services that allow us to continue to provide state-of-the-art and unparalleled care to our community. So we really do help to fill that gap so that our hospital can continue to grow and be able to serve the community in the way that we've been able to in the past 60 years. We played a critical role in supporting our frontline workers during the COVID-19 pandemic, and that actually has really set the stage, I would say, for how we approach philanthropy since the pandemic. Our funding priorities include, and I've been here about 7 years, we've really tried to kind of shift the way that we do fundraising. And instead of just focusing on capital projects, which we still do focus on because we really need to be able to support hospital initiatives with campus revitalizations, building new buildings, new renovations. But we really are focused also on community outreach initiatives, workforce development initiatives, and team member resiliency and well-being efforts. And I would say that the team member resiliency and well-being efforts, while we did a little bit of it before COVID, COVID really was the catalyst for us to really be focused on what we're doing to support all of our team members, but in particular, our frontline team members. And, you know, thinking about why we do what we do and how we do what we do, some of the obvious questions would be, well, what is the importance of investing in, again, what we're calling the heart of healthcare? And I would say there are 4 main points. One is we want to make sure that we're helping our healthcare workers, particularly, again, our frontline workers, really build resiliency, build and maintain resiliency. There's a lot of research and a lot of articles out there that talk about the lasting impact of COVID-19 on healthcare workers and first responders. And we know, and we continue to see that a lot of our frontline healthcare workers still are anxious, still suffer from depression, kind of a PTSD type thing, burnout and stress. And some of that has to do with just the collateral damage of COVID, right? Both the initial collateral damage of, the unknown of the pandemic 4 years ago, which it's hard to believe it was 4 years ago, but that was so stressful that we had all these healthcare workers who were really taking care of, their patients and with a disease that no one knew anything about. And then they would go home and were, afraid to be around their families and filled with kind of some angst about, would they get their family sick? And then as the pandemic progressed, that burnout continued as we started to see, people leaving the workforce, particularly in healthcare. So building resiliency is one of the big focuses that my team has had over the last 4 years. And that's one of the big pieces of helping our healthcare workers to be healthier themselves. I would say the other big lesson and piece of importance in investing in healthcare workers, and this is huge, is to help retain our workforce. I believe most people are familiar that hospitals in particular are really suffering staffing shortages, and that's led primarily by the nursing shortage, which is continuing to get worse. And projections are that it will continue to get worse for all the way through 2030. Right now in the state of Maryland, we have data that pretty much suggests that hospitals in Maryland are unable to staff at some point, at any given point in time, up to 25%. So 1/4 of our beds can't be staffed because we have staffing shortages. Again, that's a lot of that is nursing, but we see staffing shortages in our support and ancillary staff also. And so if we can show our staff and team members that we're really investing in them, our hope is that we'll start to see a stronger retention in our workforce. Now, obviously, we're in the foundation, so we're building programs to, as you'll see, the programs we have are more about, they're supplemental with what the hospital is doing in terms of bonuses, retention bonuses, taking a look at market salary, and doing things that they're doing on the hospital side. But together, the hospital and my team in the foundation, a lot of the programs and initiatives we have are really targeted at, again, helping to retain that workforce that's so critical to the health of all of our communities. Another element of importance is really for the University of Maryland Medical System, our values, which go across the bottom of the screen there: compassion, discovery, excellence, diversity, and integrity. If we are not part of investing in our team members is really to invest in that culture of caring and compassion, which is fundamental to who our system is and to who our hospital is. And so we really think of the investment that we're making in healthcare as part of that reinforcement and demonstration of building a culture of caring and compassion. And I think that's really important because when you think about healthcare and the demographics of who we employ, we employ minimum wage workers all the way up to doctors who, are actually doing brain surgery. And so that's a huge spectrum of people. And so there's also a bit of equity that goes into, I think, part of what we're doing with some of the programs that we create. And then finally, another aspect of the importance of investing in our healthcare workers is really to promote and help build opportunities for professional development. That goes kind of hand in hand with retaining our workforce. But I think it also is a standalone area that I want to make sure that we're doing whatever we can to foster both professional development, but that also helps to foster personal development and growth. So those 4 areas are what I consider kind of to be the hallmarks of why we are taking so seriously our mandate, if you will, to invest in our healthcare workers. And so these are a few of the ways that we do that. One is the Employee Emergency Assistance Fund. So that was stood up in the summer of 2020. And we stood it up, each hospital within our system, if we didn't already have an assistance fund, we were expected to stand it up. And we did stand it up. And that was in response to so many of our team members, were impacted by layoffs in their family. They were impacted by daycares closing. They were impacted by schools closing. And so we know, especially for our lower wage workers, there were some huge economic challenges that everybody was facing at that time. So we stood up our Employee Assistance Fund, our Team Member Assistance Fund, and we have, it was important enough and we had enough response to it that it's now a permanent fund. It's not just in relation to COVID. And so I'm proud of the fact that I think we were able to work with our community, work with other employees to really make this a permanent fund and a permanent resource that our team members in need can turn to. The assistance fund is designed to help team members cope with unexpected financial hardships or crisis. So disability, loss of a job, reduction in wages, a natural disaster, death. We've seen a little bit of all of this in the 4 years, almost 4 years that this has been up and running. We've been able to help, I think, at least 2 employees who have had fires and have lost everything in their house due to fire. We have been able to help with funeral costs for some team members who have lost a child. There are 2 of those that I can think of. And then there's been several, and I would say the vast majority of our team members are just dealing with reductions in wages, spouses or partners' loss of job, unexpected disability or unexpected illness. We do have a structured application process that's overseen by an independent committee. So the foundation actually administers and writes the checks for the fund, but we're not the ones who are evaluating the need. And there is a very structured process that our employees have to go through. To a large degree, the employees remain anonymous. They do need to be in good standing. We also have some caveats that we have a cap on the amount of assistance that we provide, and you can only come to us, I think it's twice in 1 calendar year. We make the payments directly to the landlord or the utility companies, property management companies, lenders, the funeral homes. So we're not actually writing checks to the employees themselves, which is other financial assistance programs that I've been involved with. That's pretty much how they work. And we do try to refer our team members in need to additional resources, especially when you see somebody who's come back maybe more than once or who needs help with more than one payment or more than one company that they owe money to. So we do try to refer them to additional resources that can maybe help them with financial management and help maybe grow their literacy with financial management. We'll also refer them to additional county resources if we think that they're in need of more help than what we're able to provide. In total, so far to date, we've given over $120,000 to about 60 team members. We don't get a huge influx of people, so I think that reinforces that we get people who are coming to us because they actually do have a need. We actually also will have some of our leaders refer their team members on their individual teams to us for help. And so that's one way where we're really working hard to try to, again, help our healthcare workers. The majority of the folks that we're helping, I would say, are lower wage frontline healthcare workers, medical assistants, patient care technicians, our companions, our transporters, and so we're happy to be able to offer that resource. The other another way that we are helping and investing in our healthcare workers is through our Nursing and Allied Health Scholarship Program. We have had this up and running for, I want to say, about 15 years now. We've awarded over $500,000 to more than 500 team members. We make the decision that we want to help as many people as we can with smaller gifts. Our scholarship program is supplemental to the system and the hospital's tuition assistance program. So folks can apply for tuition assistance reimbursement. And then on top of that, anybody who's in good standing and meets the criteria for the scholarship program can apply for a scholarship also. And they are allowed to apply for scholarships more than once. So you can apply for a scholarship over consecutive years. You can apply for scholarships over non-consecutive years. Our scholarships help with getting an AA degree. They would also help with getting your bachelor's and even your master's degree or a doctorate degree. So we've actually helped everybody in all aspects of kind of the entire spectrum of education. And we award those. Last year we did it actually twice. We award them once a year, and we have a very nice kind of celebratory recognition for everybody who is being granted a scholarship. We also have special scholarships within that main fund that are basically endowments. One was for an oncology nurse who passed away very unexpectedly. And her department, then along with other folks, created not quite an endowment, but it's getting close to an endowment to any of our nursing staff who actually want to go back and get a supplemental certificate or degree in oncology nursing. And we just have a brand new scholarship that we're rolling out this year that's in memory of a young woman who actually was tragically killed last year. Her mom works here and is a medical assistant in our surgery center. And we have started a scholarship in her name. So there's that opportunity too. And that actually recognizes the application criteria is a little bit different for those special scholarships. The other thing that we do to invest in our team members is some really innovative programming. And one that comes to mind, and the biggest one that we're working on right now, is called our Spark Tank. So if you think about Shark Tank, at BWMC, we're calling it Spark Tank, and it is the special performance award that recognizes quality. We actually, at the end of February, will have our very first Spark Tank. And that is a fund that is, it's an innovation fund. And we've created with our quality team, our medical team, and a couple of the other clinical teams. It's a fund that will recognize and provide resources and organizational support for creative solutions that help us meet challenging organizational needs or problems. And we're super excited about that. So across the system, anybody could submit an application for Spark Tank with an idea. And we had an initial panel, multidisciplinary panel from across the hospital that took a look at the submissions that came in. And then some of them we kind of sent back to the drawing board from the get-go, but we have of the 11 that came in, there are 8 of them that we actually set them up with a coach to help them really flesh out the idea and come up with a budget for the idea and a projected impact, and actually almost make it more of a kind of a grant application. And from there, we will have community members as well as hospital employees do the judging. And we have for our inaugural Spark Tank about $30,000 that we'll be able to award to probably 3 or 4 of the applicants. The other 3 or 4 we believe will be able to get funded through other foundation funds or through some special funds that have been set up in the hospital. So we're super excited about that. And I think that really speaks to our recognition of, you know, our desire to be innovative and inclusive and have everybody in the hospital, no matter what level you are or what your education is, be able to feel like you're contributing in some way, shape, or form. So other ways that we really invest in our team members, and a lot of this is still, again, maybe was stood up because of COVID, but these are big, these are ongoing priorities for us and will remain priorities for us. And so really some resiliency and well-being programs. We have, we through the foundation fund a type of rounding called the Schwartz Center rounds. And so these are what we call a ground rounds style event. And so we get a bunch of our team members in a room, and they're attended by about 100 employees who take time out of their schedules during the day and usually come on their lunch break. And these are held quarterly. And the Schwartz Center rounds have a multidisciplinary panel of team members, clinical team members who have who are focused on a particular a particular theme of care or a particular case, a particular patient situation, past patient situation. And all of the situations that are focused on, really, they focus on the emotional impact of patient care on our team members. And so this multidisciplinary panel will share their experiences and their feelings, their fears that they encountered during a particularly maybe challenging or disturbing patient encounter, or an ongoing theme that has come up more than once in the year that we've been doing Schwartz Center rounds, touches on team member violence. And again, I think there have been a lot of articles in a lot of newspapers, magazines, everywhere about just and we see it on the news, right? Violence in our society in general, but there's a lot of violence that happens, workplace violence that happens against and to healthcare workers. And so Schwartz Center Rounds has really offered an opportunity for this panel to kind of bring up, some talking points and get some discussion launched. And then it opens up to audience participants who can also relate to the theme or a similar patient that they encountered. And it really allows team members to open up and share experiences. We have our chaplain there. We have some of our leaders there. But it's really an opportunity for them to share experiences and for them to help each other and lift each other up and offer just a sense of caring and compassion for the experiences that they're having. And this is it's a very special and very rewarding. You don't have to be clinical. I ask that my team attend it every time we have this. It's a strong reminder of our mission and why we do what we do, and just the challenges that come with that mission. We also have mindfulness and well-being initiatives that have been, in some cases, developed by the foundation, but also absolutely funded by the foundation. We're responsible for leading the final creation and the final development of what we call Zen dens. We have Zen dens on 4 of our 6 patient tower floors. And those are just respite areas that our team members can go to just to go if they're having a particularly tough day or have been dealing with a challenging situation, they can just go take a break and go sit in our Zen dens and take a deep breath and read some inspirational quotes or read a book and just step away for a few minutes. And the foundation was responsible actually for the funding of those and the funding of some of the programming that we do in those Zen dens. In the peak of COVID, we funded virtual mindfulness workshops through an organization called the Awake Network. That was born and bred out of COVID, but it was again attended, I think, by over 150 of our team members over, I think it was a 3 to 4 week series of workshops, all virtual, that really helped to build mindfulness, build resiliency, be there for our employees. Last year, 2 falls ago, we had an inspirational speaker, Dave Raymond, who actually at one point in time was, I think he was the first Philly fanatic for anybody who's a Philly fan. He now does inspirational speaking, and he came out and spoke to a conference room full of team members about the power of fun and the power of remembering to have fun when you're working, the power of remembering to balance your work fun with your private fun and your family fun. And that was another inspirational well-being initiative that we were able to fund.
Hey, Kathy, sorry to interrupt. We probably have the clock running out in about 30 seconds.
Perfect.
So what I would ask is once the room closes, for anybody interested in hearing the rest of the talk and doing a proper wrap up, please just rejoin the room, click the link, and we'll do a proper wrap up.
All right. Actually, this is almost done. We do a lot of thank you rounding with snacks and care and comfort items. These are all donor driven and all from donors that are